Hi, it's Crystal Lim, nursing student at Franklin University, Nursing 703. I'm going to do a presentation on stasis dermatitis. Stasis dermatitis is redness, brown hyperpigmentation plaque with fissuring and scale on the skin, and it's usually located on the lower legs. Here are a few examples. Stasis dermatitis is an inflammatory dermatosis commonly affecting the lower extremities. It can occur in patients with chronic venous insufficiency, and it's often associated with varicose veins and chronic edema. Clinical features include redness, scaling, weeping, crusting, hyperpigmentation, lipodermatosclerosis, and ulcerations. Patients usually come in with those symptoms and signs, including some itching, erosions, exudate, and crusting. It's common on the lower third of the legs. It can be unilateral or bilateral. Lichenification can develop. Pitting edema is often present, and so are varicose veins. Venous stasis is the outward sign of stasis dermatitis is the outward sign of venous stasis or venous insufficiency, where that normal venous return is interrupted and not adequate. Early signs of venous insufficiency include some tenderness, pitting edema, hyperpigmentation, varicose veins. Late signs are the lipodermatosclerosis, venous ulcers, scars that appear porcelain white and atrophic. Risk factors are hereditary, older age, female, pregnancy, obesity, prolonged sitting, sedentary lifestyle, prior injury or surgery or DVT, heart failure and hypertension are often aggravating factors. Clinical presentation and history and physical are usually the mainstay for diagnosing. If needed, duplex ultrasound can be used where it demonstrates the venous reflux. And diagnostic skin biopsies are rarely indicated. Sometimes they're used to see if it's an allergic dermatitis. The lines of therapy, the main thing to do is treat the underlying venous hypertension insufficiency to help heal the legs. But to treat the actual skin, you can use application of a super high potency steroids, elevate the legs, compression, change those wraps, keep them clean and dry, adequate skincare to help prevent and treat any more issues with the legs and treat the ulcers if they develop. Interventional therapy can be used as well if that doesn't work to treat that underlying venous insufficiency. You can do minimally invasive techniques such as thermoablation and foam sclerotherapy. Patients can do things to help reduce symptoms when they're trying to get better, to reduce the swelling, just getting up, walking around, not sitting or standing in one place for a long time, raising your legs 2 or 3 times a day, doing exercises to your feet and legs to help move the blood flow. To treat the skin, washing your legs daily with gentle cleanser, not using regular soap, and unscented moisturizing creams or ointments, or the cream that's prescribed. Patient education, prevention is key. Prevention of not letting the stasis dermatitis turn into ulcers. So it's important to have some lifestyle changes, such as, again, minimizing the prolonged standing and elevating legs, using compression therapy and hosiery, starting regular physical activity, even if it's walking just 30 minutes a day for a couple days a week, losing weight, avoiding local trauma to the area, and then seeking early medical intervention if the skin is damaged in more areas than was before. Often, chronic venous disease does result in decreased quality of life, secondary to pain and physical function and mobility. There's complications that can happen with venous insufficiency, DVTs, recurrent ulceration, hard healing, contact dermatitis and cellulitis if there's any open areas that bacteria gets in, poor wound healing, and again, more ulcers. Venous insufficiency ulcers, they're tender, shallow, irregular ulcers with a fibrous base that often occur below the knee. Patients need to follow up. They need to have a close follow-up with a provider to treat the legs, and then also work on treating the underlying conditions and preventing any secondary infections. Thank you so much. Hope everybody has a great day.